just want to say a little bit. Dr. Lester, as mentioned before, Jeff Lester's actually in this area. He's in Watsonville and in Santa Cruz. He's an integrative medicine specialist, and he focuses on homeopathy. So today he's going to talk about a little briefly how homeopathy sees MS. We're continuing our Creating Health series, which is to find the different modalities that can help you help yourself.
Very good. Well, welcome everyone. And glad to share with you some wonderful information we have about how to help people with various conditions, autoimmune diseases, of course, multiple sclerosis being the focus. I've treated that for over 30 years using these techniques. And I am an osteopathic physician, an allopathic physician, meaning I do write prescriptions for things, keep up with the latest medical advances. And I do classical homeopathic medicine where you give an element that matches, basically, we're looking to match something that matches the negative source, the deepest source that we can see. That's what the tip of the cone means, the deepest source of the root of the disease that you can. And then you try to shift that out from the negative state to the positive state. And what happens is the problem begins here in what's called the limbic system, the center of the brain. And doing the hypnotherapy techniques, visualization, positivity, those are all inputs from here. We're a little sneaky. We sneak up a preparation up to the center of the autonomic nervous system and immune system that starts to unload negative thought information, negative feeling, and the source of the disease. You have something here that says that the disease begins with an energy, just a feeling of the nervous system, and then it goes into emotions, thought, chemistry, and then structural damage. So the sooner you erase the negative tendencies inside the immune system in Germany, where this started, it's called the neuroimmunosystem. The sooner you begin to erase those out from the center of the brain, like when we interview people who have autoimmune diseases and multiple sclerosis, they say things like, those years of my life really ate on my nerves, or that situation really began a state of tremendous difficulty for me. And then between 5 and 10 years later, it starts to form what's called a category 4 problem. And these are 5 categories we use to diagnose people. The top category is the inflammatory category. So we focus on giving elements to remove the tendency to inflammation. The second category is the contraction category. Fears, anxieties, feeling out of control. Again, this is back in the limbic system we're talking about here. If you remove that, and I'll tell you a little bit later exactly how we remove that, then you get free of it. You don't develop these physical. This would be the emotional state, and this would be the physical manifestations of leaving it in the nervous system for too long. Things like spasm, contraction. The first is inflammatory, inflamed nerves and inflammation of the body. The third is weakening. So people who've gone through griefs and losses or been overwhelmed for too long will have a weakening of their system. And that's a very dangerous category. You can actually have a 1-2-3 or a 2-1-3 or a 3-2-1 architecture of how the nerve sets up those things. Category 4 is the most dangerous category. That's the category of resentment. And resentment chews up the nervous system. You can see down here, neurological degenerative disorders. That's for multiple sclerosis is down here as well. You've got to come in contact and bring your brain's awareness into that, because the awareness, that's what this diagram means. The awareness of the frontal brain, your body, to the limbic system and the hindbrain here, when you integrate those 3 brains, the intelligence of those starts the repair process. This represents a blocked state. And when you're stuck in a blocked state, that's what those bars here mean, is that the hub, this is like a circuit board. And when that hub is blocked from accessing your life is out here. So you might say this is the blind part of the brain. What's happening out there? Why am I having this feeling? Once that feeling is deep and trapped in here, the consciousness usually will just shut it down by sending a bar here. So we suppress our own tendency to heal. So this book by George Vithoulkas, he's one of the founder of modern homeopathy, has come and gone 3 times in history. Used to be the main medicine in America between 1840 and 1940 with radical cures of all kinds of things. This was the very first book I read that was Homeopathy Works. It's a very simplistic book, but Dr. Gray was my original teacher. He's a Stanford trained MD. And this book was written by Robert Wood, who was cured from asthma and allergies with Dr. Gray. And on the back, it says, homeopathic physicians can cure things like chronic allergies, arthritis, asthma, gout, heart disease, hypertension, depression, and schizophrenia, early stages of cancer, and AIDS, because AIDS was the topic when this book first came out in the early 90s, when I was still working in the ICU, working with AIDS patients in Miami, where it was a huge outbreak. And when I read this, I thought, I wonder if that's just a bunch of malarkey or if it's really true. So I went to meet Dr. Gray, and he told me, you'll cure more people every week in your practice using homeopathic than a doctor will see in a lifetime. So I started sending him patients that had these diseases, these chronic diseases, multiple sclerosis being one of them, and wanted to see it proven. And when I saw some of the cures happening, that was enough to sell me on it. The first being a little girl with juvenile rheumatoid arthritis, could hardly walk. So the process of studying homeopathic has been very hard in this country because there are not a lot of schools, and most countries, big countries like England, Holland, France, India, and Italy, Germany now, homeopathy is taking off tremendously. Here it's a very snail's pace, and we hope this year, God willing, that I will start a Zoom conferencing for both training and information where people can bring this medicine back into use so you don't find people finding it way late in the game. The earlier we get to people with serious degenerative neurological diseases, autoimmune disorders, seizure disorder, lupus, all those kind of things, the more we're going to make a significant difference. Because when you do that brain conversion from going from the negative state to the positive state, then once you're in that state, the healing journey begins. So you might say it's a process of connection. The healing journey is to move up on this curve as you move up after you unlock the system. This is the contraction state, the purple. You don't want that. And you match a preparation that matches as closely as you can the way a person is stuck in a negative state. That's what the word homeo means, similar. Pathos is pathology or suffering. Similar to similar, negative to negative, shatters the negative and creates a positive. But this is the problem right here. On this diagram, the negative state is covered up through heavy armoring. The armoring is trying not to feel what's gone on inside. So this would be the limbic system that has been damaged. It was fine here, and now something happened in life between the age of 8 usually and 25. You start to contract. If we can remove that contraction, you don't have to develop deterioration. Awareness, through awareness. So here, the person is heavily armored. It says here that layers get set up as armoring against a negative influence. Filter layers get set up between the age of 8 and 12. The more wounding that occurs, or negative genetics, which is a German word called miasm, which means illusion, darkness, negativity. The more you inherit, the more layers get set up more quickly in life. So if someone has 75 to 100 layers of armoring, then it's a much bigger job to get through that. The green represents how we're trying to drill through the armoring to get to that very sensitive core so we get this out of the nervous system. You might say that multiple sclerosis is a form of this. That's what the nerve is saying. So you got to get to that little inner scream, you might say. You got to get to that place of betrayal, of that place of where you got the rug pulled out from you, the place where you have maybe genetics that got inherited. That would be the bottom side. The top side is psychology. And then lifestyle. We do have a lifestyle program in all of our offices. And genetics and neurochemistry. That's where the homeopathic system is so unique in addressing what you are burying. So we're trying to get into 2 kinds of burying. One is you bury things that happened in your life. That's the top side. and the bottom side is what you inherited. So you have to get both out. The good news is you can. The bad news is most people don't know about this till they have more serious disease. So if you have a miasm, which means you inherited some negative genetics at any age, doesn't matter how old you are, you have to work to get it out before it causes disease. That's what this book says, is if you only use suppression as your main form of treatment of medical care, not only you, but populations in general are going to develop more and more serious disease. And this is a great book written by George Vitholkas. This represents another schematic of an open system where the mind, the body, this is an open chamber. And this represents the miasm or negative injury from life as these black dots. The black dots represent the negative memory. So as a doctor, we're all trained to suppress. You come in with a symptom, and on this side, it's pushing it in or suppressing it. You can do emotional suppression or physical suppression through drugs or alcohol or addictions or distractions. This represents a doctor trying to pull it out from the root. Much harder, because you got to understand how to access that inner part of a person. And that's done through a 90-minute questioning, intensive questioning system. This is the amount of multiple sclerosis that is happening in certain countries. And you can see the more wealthy and civilized countries have much higher rates of multiple sclerosis. And later, since the 1970s, it's growing dramatically. Same thing as we follow cancers, autism, rheumatoid arthritis, obesity, diabetes. These diseases are exploding. And what the book says is if we overuse suppression as the only form of medical care, rather than extraction, then not only multiple sclerosis, on the next page, it shows you incidences of cardiovascular disease and stroke. I know you can't see these exactly. It doesn't matter exactly. It just shows you that the countries that don't suppress, like you've got here, Costa Rica, Dominican Republic, El Salvador, Honduras, Mexico, Peru, 10 to 15% incidences were the developing countries, Canada, United States, Austria, France, Sweden, Northern Ireland, and Scotland. 50, 40% chances of strokes and cardiovascular diseases. In the MS group, after the developing countries, zero, it says at the bottom, zero multiple sclerosis in Egypt, Barbados, Costa Rica, Suriname, Trinidad, Singapore, where United States, 1,704 cases reported in 1972, and it goes up and up over the years. So we're doing something wrong, and it's not such a mystery. Why are there more autistic children? Why do we have more cancers? The incidence of cancer is on the rise. We have better treatments for when you get it, but the incidence of cancer is on the rise. So as physicians, we weren't taught the most important thing was how to get deep inside the system and do this very simple conversion. The concept is simple, but how to gain access to the center of the nervous system and immune system, that's the challenge. So the way you do that is you sit with a patient. Hopefully they've watched we do once a month webinars, and I do have assistants now that help prime people to get ready for the intensive session where you do what's called constitutional typing. This is a book that you can also get online for very cheap now. That it doesn't tell you the answer, but it tells you the how we try to do this. It doesn't always find the answer for you. But constitutional typing, you study 4 parameters. You study what environment made them sick, perhaps what food or toxicity made them sick. You study what type of stresses in their life they're sensitive to that makes them sick. And then you study the response pattern. The response pattern tells you the individual makeup of the person. So this is something I made up also for my patients to have more success with me, with just 3 simple questions. What is the inner feeling inside that's unhealthy for you? That's 10% of the diagnosis. 90% is what is the negative response pattern, both physically and emotionally, that's coming out of that inner negative feeling. And this is where Ava's work and therapists and psychotherapists and psychologists can help the process of putting true true labels on what really is the deepest cause of the problem. So here's another diagram, and we go, what's called the true self gets wounded and goes into the wounded state. If you don't heal from it, then you fall into, you stay there for a bit until you go into the next state. It's called the compensated state or self. And then if you don't heal that, you go to the false self. And that's the dangerous part of what's happening, is the false self is the gray layer. All these other layers are the compensated self. This is stuck in compensation. The wound is from the outer side, and then the healthy self is the limbic system in the green state. So it's hard work. Homeopathic medicine is not for, it's not a casual system. We push people very hard to identify, again, what is the feeling inside you that is troubling you. I use my 5 categories. We sometimes, especially with men who are not always good communicator, okay, we're going to go through all 5 of these. Tell me how you repress or handle anger. How do you repress or handle well anxiety, grief, loss, depression, overwhelm, resentment? And by the way, there's healthy versions of these and unhealthy. There's healthy anger and unhealthy anger. There's healthy fear, like it's called concern, or healthy worry. There's healthy and then unhealthy fear. There's healthy grief. It takes time to grieve the loss of something. And if you repress that too quickly, it's going to weaken you. And then resentment, healthy resentment, that's the hardest thing. Healthy resentment is someone betrays you. It takes you between 2 and 5 years to process that thing before you are fully resolved. People say too quickly, especially in America, I'm over it. I said, no, you're not over it. You're numb to it. And I'm sure someone like Eva will say, okay, let's get you down in there a little bit. So when they prime you and get ready to come and talk to me, because we do a 90-minute intensive intake, we want to know all the physical and emotional ramifications of what has not only made you sick, but is keeping you sick. And the 5th category kind of stands alone. It's how sensitive you are. People who have high sensitivity levels are much more vulnerable to get neurological diseases than are more callous people. But if you take a sensitive person and they are exposed to something very negative, they have a much harder time letting it go, because it reverberates in the brain called something called negative memory echo. The echo, I always say, don't let the wound hurt you twice. If it hurts you once, that's hard. The twice is when the memory of the wound continues to fester inside. And this is a filter layer that represents the layers, the armoring layers. The thicker the filter, the less we're able to access, and the less eventually you're able to access the original root cause of the disease. That's where it gets very difficult, is how much thickening of the filter you have done. These are 5 different levels of 6 different levels of filter architecture. A healthy filter is open for business, lets things in and out of the limbic system. You feel very secure after you're over the difficulty, like after a good cry or cathartic therapy. But when the filter is too thin, these are highly sensitive people, it's hard for them to wall off negative influences. And they need to be treated so they don't go into what's called tightening. A tight filter sets up in a sensitive individual, trying not to express things and feel, but the body gets very, very tight. That's bad for the system. Or thickening. These are people trying to numb themselves. This is very common in multiple sclerosis, as you form sclerosing plaques around the nerve. Why are those set up there? Because you're trying to armor against some kind of abuse or trauma from the past. So I understand why you thickened that filter. You've got between 5 and 15 years, and then you must thin that filter back down, or else it's going to not let you heal from the disease. Mosaic filters, that'd be more your ADD, ADHD, schizophrenic, bipolar people. And the broken filter is the nervous breakdown, where you get a sudden flooding. This is what everybody fears, is if I break my filter, I'm going to suddenly have panic attacks, anxiety, nervous breakdown feelings, or this is the physical filter, that's the emotional filter. What homeopathics do is they come up here and they ask one question: is this what it feels living with that negativity inside of you? It asks the central brain, and then it goes to the peripheral system as well. And the more it binds many receptors, then the more dramatic the response. So if you've been to a homeopathic practitioner and not found success, that means they were off target. Or it can take MS patients longer to respond because of that armoring that was a protection. So the center field represents the green line is the treatment. The black line is the summary of the addition of all the symptoms that your body's trying to tell you that it's not happy. So that would be, forgive me for flipping around here, but that the black arrows represent symptom, symptom, symptom. You go to a doctor, the doctor suppresses the symptom. You go to a homeopathic doctor, we don't suppress the symptom. We want lots of symptoms to talk about, because when we add those up in the end, the feeling with the negative response pattern adds up to one theme. And when you leave my office, you leave with one medicine, not 20 different supplements. You leave with one medicine that's going to start to melt down armoring layers. So usually treatment that starts it is just to begin the process of releasing the armoring layers that are starting to cause the restriction. That would be here. Melt down those armoring layers, because that's what forms the plaques. The thicker you armor, the more the plaques form. Melt those down and then touch that core. And once that core is touched, you get this conversion, but only if the patient is a good communicator. Lots of people come in, they're so unconscious of what's going on that we are not able to touch that inner core right away. It can take several preparations to melt down those armoring layers. So this diagram says stronger responses are felt in a person when correct information is accounted for during the interview. The practitioner's ability to fit the homeopathic prescription is highly dependent on the completeness of the person's history. When not fit accurately, you quickly get very little or no response. So this is a bell curve. That's where you want it right on the money. You still get action if it's here, but once you're outside this target, you get no response at all. So you can't go to the health store, pick something off the shelf and say, I've done homeopathic medicine. That's not how it works. It's a very highly specific system, and you must honor, as a doctor, you have to honor the armoring layers got set up there for a reason, whether it's negative genetics or if it's multiple traumas that have occurred. And then you melt those down slowly. And once that core expands, there is a cathartic phase where emotions come up, thoughts come up. It's not too long. It lasts 2 days to 2 weeks usually. And it happens for 1 to 2 hours a day, not for all day. And you have a cathartic experience. You go to therapists or your hypnotherapist, like Eva, to get them to help you process it faster. What we do is we have a lock and key idea. We unlock it, bring awareness to the negative, and that starts that whole healing process. So the concept is simple, but how to get in and do the treatment, that is highly dependent on the patient's ability to cooperate. And then we have 2 healing curves. This is a conservative curve where some people just, you use what's called high doses and low doses. You take a high dose and follow it with the daily low dose of the preparation. They're little sublingual pills, and you begin this ascent, releasing. Every time you have a peak, you begin to connect the frontal brain with the back of the brain, with the peripheral nervous system, with the immune system. You get a peak. During the connection of the negative to a negative, you don't feel great. You don't feel anything. You don't feel, either you feel nothing or you feel a little negative emotionally or physically. And then the release is where you get the amazing difference. The original doctor who discovered this was in Germany from 1755 to 1843, Dr. Hahnemann, for which I welcome all of you to look up Hahnemann Monument in Washington, D.C. And you will see a giant statue of him saying he revolutionized medicine in America. That's Dr. Hahnemann. And what he observed is that when people got sick with had a chronic condition and they had an acute condition happen, the acute disease would sometimes cure the chronic disease. And he wrote this diagram. Touch the person when they're in the chronic state, and it helps them lift off and shatter the chronic state. So when he passes on, Dr. Kent was the next in line. He was born in Woodhull, New York, 1849 until about 1916 is where he lived. He has that wonderful mustache there. That he organized homeopathy. He wrote books that were very hard to read, but he brought it to more fruition. And they formed homeopathic hospitals. This is a Denver homeopathic hospital back then. And they all said the same thing. If a disease can cure a disease, we should be able to cure people using a substance that's, he called them artificial diseases. And he takes belladonna plant, china from Chicona tree, and you dilute them down. How he came to the second most amazing part was probably an accident, because if you're using a toxic substance, he dilutes them down, and this is still how preparations are made. You take a substance, is it, if the person either ate that substance or this is a concentrated substance, if you drank some of that concentrate, you develop certain symptoms. When you go from the concentrate to the dilution, that's called a potency, and you give the potency to the person that reverses the state they would be in if they drank that or ate that substance. So he said, give an artificial disease to the person, either from plant, animal, or mineral extract, to wake up the system to get it reconnected so it can heal. And that was in the day before they had CAT scans, MRIs, lumbar taps, and laboratory assessment. So you're matching a negative to a negative to shatter the negative state and bring it to the positive. Unfortunately, in America, since we are so wedded to the quick fix assembly line system, we become experts at doing it for you. This system's harder because it makes you do the work. Homeopathic, I always say, it's not for wimps. It's for people who are intensely focused on getting to the root cause. Sometimes it's hard to get people to talk about it because they don't want to relive it. So I'm over that. I said, well, you may be over it from the neck up, but from the neck down, you're not over it. So you have to use your smart brain, it's called the conscious brain, to contact the unconscious and to get out something that's been with you for many years, to get in contact. Of course, we like to get people as soon as possible to begin to clear those circuits. So this person in the healthy state is much, much more able to heal. And the way I came to these concepts is I was doing cancer research at Brandeis University back in the early 1970s. And we were studying adenocarcinoma of the abdomen, where we would inject a mouse's belly full of a cancer called adenocarcinoma. And the mouse wouldn't grow the cancer. It just wouldn't grow. So what happened in Rhode Island is there was a group trying to help research, and they knocked the mouse's immune system down with a DNA error technique. And everybody celebrated that now we had a mouse, you inject the belly full of adenocarcinoma, it was able to grow to study chemotherapy to kill cancer. And that's where I had a problem. I said, wait a second. If we injected a healthy mouse with adenocarcinoma and it can't grow, that would be the green. Why are we not studying that? Why are we only studying how to kill the cancer rather than why couldn't the cancer grow in that mouse? So that's been my journey through my whole life since I went to medical school in the early 80s and then graduated and got out, and I studied in 7 different medical systems looking for a system that could do basically this: convert the immune system from the contracted state to the free state, from the armored up state to the free state. And I tried acupuncture, we tried supplements, we tried IV therapies. I had a hypnotherapist working with us, a psychologist, a massage therapist, nutritionist. And the piece that was missing was helping people see the true negative that was inside of them. And that would take a very strong therapist to do that, or hypnotherapist. See the architecture of the compensated self and the false self. Those need to go. Those are preventing you from healing. And then luckily you don't stay in the wound state. You don't relive the wound for that long. It's not that painful. And once you get to the true self, that's the part of you that's able to heal. Trilogy Medical Centers, that's what I've created. The name means 3 parts to healing: the mind, the genetics, neurochemistry, the body, and lifestyle. You can't be healthy if you're eating at McDonald's all day long and drinking high Coca-Cola, stuff that still happens in our town. And I have one practice in Santa Cruz and one in Watsonville. People in Santa Cruz are a little more enlightened about uh, this part, so they don't come in for, we do have a dietary program there. In Watsonville, people have been brainwashed a little bit. There's too many fast food places here in Watsonville, and you see kids waddling around extremely unhealthy. We tell them, get off the hidden sugar. The hidden sugar is in the starch. So that's what they need. But if you have multiple sclerosis, that's a inherited weakness. You're usually this is a Santa Cruz therapist wrote this book, highly sensitive person. You take the test. Yes, I'm a highly sensitive person. I don't even need to take that test. Okay, then if you're a highly sensitive person, that means you do not get over things once. You have to get over it 7 times. It takes many times to review things. And what I love about the homeopathic system is that as you're coming in consciousness with the hidden things inside that limbic system, we're speeding up the process of release. And luckily it releases mostly out the back door, so you don't need to talk about it. I just did a couple yesterday, husband and wife have been married for 44 years, and we're gonna clean up their negative brains so they can be more gentle with themselves. And he developed sudden high blood pressure, and she's developed colitis. So they come in to find, why am I sick and not getting better? And the answer is always the same, because something knocked you from the green to the purple, and instead of healing, you went this mode. And doctors are increasing this mode through the use of opiates, numbing medicines, gabapentin, anti-seizure medication, Lamictal, all these things. I saw a boy today, he's only 15 years old, already on Lexapro. Now, what the heck is a 15-year-old boy doing on Lexapro? And his brain is very sluggish. I told mom, he needs to get off of that. I think it made her job easier than it did for him. He sleeps 5 hours per day and 12 hours per night. There's something wrong with this boy. He's already armoring up from the ripe age of 15. And I'm sure in his future, he's slotted to have a lot of diseases related to that. By the way, there's 7 regulatory signal centers in the brain that correspond to how you sleep. We go through all 7 of those. How are you sleeping? How are you waking up? So dial 1 and 2. 3 is temperature and circulation. Are you freezing cold? Or are you on the hot side? As you know, MS patients are very sensitive to heat. They're sensitive to a lot of things, heat being one. And then thirst and appetite, fullness, metabolism, hormonal function. When I say hormone, I mean thyroid, pancreas, adrenal, and ovaries and testes, not just ovaries and testes. And this is the most important. The adrenal system is based on the hypothalamic pituitary adrenal axis. How are you doing with the balance of the sympathetic and parasympathetic nervous system? So that would be get up and go, good energy to get things done. And the parasympathetic is your ability to stay relaxed while you're doing it, including process work. And primal emotion would be how you feel about yourself, things like self-hate, self-deprecation, doubting yourself, negative self-talk. That's all got to go. And you do it with these preparations along with psychotherapy and hypnotherapy. That all has to go. You clean all of these circuits in the back of the limbic system, and that's how you create health. And when I talked about this in my medical school a little bit, I didn't know all the details as I'm telling you now, but just that I knew there was more to health than what we were getting trained in medical school. It created quite an unrest there. I had to really speak before a group and say, I promise I will learn all of regular medicine as you teach me. And then once I graduate, I will go on for a second medical school. So I actually did 5 years of medical training and residency. And then I went on for additional 7 years of homeopathic training. My daughter's in pre-med right now in undergrad. She has to go through 4 years of undergrad, 4 years of medical, 3 years of residency, and then start 4 to 5 years of homeopathic training afterwards. We're in India, where this is extremely popular. Right out of high school, you say, I want to be a full doctor. You get your undergrad, your MD and homeopathic degree done in 6 years. And until that changes in America, then no one is going to go back in and do this kind of training. We are going to start a training program this year online for practitioners and one for the public to learn about this, to learn how to diagnose yourself a little bit, how to come clear with what's inside, and how to get to a health system that works deeply from the root, not through just vitamin C, vitamin D, and fish oils. This is not what I'm talking about. These are neurochemical elements that make 4 parts of the brain connect. Your intelligent brain, called your IQ, your EQ, the emotional intelligence, your BQ, which is the body intelligence, and SQ, your spiritual intelligence. You get all 4 of those connected, and then you're like that mouse. You can't grow cancer. You can't be sick when you're in this state. And that's what it's all about. I think this is about the fastest presentation I've ever done. So forgive me for whipping all these diagrams that took me 34 years to develop. And if you have any questions about how to do it, or if you've been the road to try it and you haven't gotten success, don't give up. You got to find a practitioner who takes it very seriously, who helps extract out of you what needs to get out. If you have an advanced case of MS, it still can help you, but it can't repair structural damage and just bring it back to life. It can stop further damage, reduce inflammation, reduce further plaquings. We have been able to get people out of bed who have had contraction states from MS. It can, I have seen that. But now what we also do for nerve repair, and you can have me back if you want another time, we do stem cell injections into the peripheral and sometimes central nervous system to try to get damaged tissue to repair. And when you put those two together, the homeopathic to get the nervous system and immune system to stop falling into the negative state, and then do injections or infusions or intramuscular injections of things called exosomes, peptides, and stem cells, you can rejuvenate things. And that in a nutshell is what we do.
Thank you. So if anybody has any questions, it's open.
I have a question. Why can't you guys repair structural damages?
You can, but you got to add the stem cell peptides and growth factors, what I said at the very end.
But that's not a homeopathy, though. That's a different modality.
Yeah,
Modalities.
homeopathy stops the negative damage that's occurring. And sometimes if you haven't had an advanced case, your own immune system can start to repair the structural damage, but it needs help. If you are, it depends on your age, because if you look at stem cells reduce dramatically after the age of 55. So if you're over 55, let's go positive. If you're younger than 55, you have multiple sclerosis, then you might need homeopathy alone might be all you need to get your nerve repair and improve. I have seen that. But once you get to be 50, 55, stem cells are reducing dramatically. So then we go outside of your body. You can pull it out of the bone marrow. Other times you use it from a post-birth material from the umbilical cord called amniotic extracts and inject those in. And those are no longer $15,000 to $20,000 injections or infusions. Those are more on the order of $2,000 to $3,000. They're more affordable to people.
I've done 3 or 4 stem cell infusions within the last 6 years. Never helped me. What do you think was wrong?
You missed the homeopathic. If you don't put homeopathic with it, you're wasting your money. Or you used it from a company where the stem cells didn't stay alive. And by the way, stem cells are not as important as something called exosomes. Exosomes, you may want to look that up, EXOSOMES. Exosomes are the active ingredient inside the stem cell. So now you can use exosome injections rather than just stem cell injections. The cell is not the whole answer. It's also the peptides, the growth hormones, and the exosomes. So you also have to go to a reputable clinic that uses material that's live and effective. But I don't let my patients do regenerative medicine injections until I see health for at least 3 to 4 months of homeopathic care first. If you hadn't done that, it's like putting beautiful grass seed on dry soil.
And also I have a question about stem cell research. It's still going on and it's changing every year. I keep thinking that whatever stem cells I got, there is a different now, and it will be different in a year, in 2 years. Maybe I should wait until it's gonna settle down in the stem cell community. Will be figured out what actually is good to use.
Well, I will recommend you go on this site. This is the state of California site. It's called cirm.ca.gov. and you can get a lot of good information on there. They are doing multiple sclerosis in the studies. And it's a very strange thing that's happening right now where stem cells got approved for use with physicians, but the FDA is saying we're still looking to see if it's effective for what conditions. But this will at least keep you abreast of the latest research, cirm.ca.gov, and you'll see a lot of good information. So I stay up with the research. Stanford, UCSF is doing a lot of the research, but as you know, research goes slowly. That's been going on since 2004. So I will tell you up front that we don't know exactly what, when, and how it can help. I have the best results, I think, in the country because I do not administer any stem cell material until you've first done 3 to 4 months of conversion of your immuno-neuro matrix. The inner part of you has to get healthy first before you can expect stem cells to be a miracle, except if you're under the age of 50, then you don't have to do this first. Unless you have a debilitating disease. If it's debilitating, you've got to stop the debilitation. It's almost like unplugging a lamp. You can't keep throwing something beautiful inside when the area is covered up. You know, this is the problem. You've got to uncover those layers first. Then when you add stem cells, you're much more likely to get a good result. I hope that helps.
Thanks.
That was a very good question, by the way. And so I wrote a little article of how homeopathic and we now call it biologic injections because it's not just stem cells, it's exosomes and peptides, how the two synergize to get a better result. And when I've done stem cell infusions with MS patients, it doesn't work that great for that long. So now I don't let them do the infusions without first coercing them into doing homeopathic first. And the good news about it is homeopathic is dirt cheap compared to stem cell use. Stem cell use has come down. So like I say, you can do infusions for anywhere from $1,500 to $3,000, depending on the clinic you go to. Homeopathic is, you're talking $200 to $300 to do intakes now that you just have to go to a reputable provider. Any other questions? Everybody understood everything I said. I said, this is one smart group. You go on trilogymedical.net and click under resources videos. You'll see me talking about everything we talked about today. So you can watch it again because it's a little bit of a head spin when you listen quickly, so you can listen again. And I love to educate practitioners on how to stop giving people empty answers, simple answers for complex situations. That's the problem in America. You've got to get involved in your healthcare. You've got to participate. This is not just a, here you go, here's your pill, goodbye. Or I saw a man the other day for his multiple sclerosis, he's doing a $30,000 infusion every time with, I forgot the name of it, to try to stop his antibodies from attacking him. And after I think the 3rd or 4th infusion, he hasn't felt a thing. And he wants to know if homeopathy can do as well. And I said, well, I can tell you it'll take some time, but if you're open and honest, we can get to that little pearl inside of you and start to liberate it.
How do you know when you've hit the pearl?
It's unmistakable. You start to come alive again. Your swelling under your eyes and your face starts to reduce. Swelling in your body reduces. Your hair starts to get more full. Not for me, maybe, but it starts to get more full. And you have a lot more energy, stamina. Your legs don't get as weak. You're able to do things more. The urination starts to improve, less leakage, and all those things. Your mind gets a little more clear and less brain fog. So that happens in these little peaks that occur when you get that liberation effect. Some people don't peak until week 4. Some people peak in week 1, and some people don't peak until week 12. So it depends on how many layers of armoring you have. So the variation of how fast you heal is highly dependent on how many armoring layers you have set up. Because the first part with MS patients is getting this armoring off and then touching that inner side there. And there's nothing better in the world, that feeling of when it converts over, you just feel too much energy. You feel great. I had one woman, she's 92 years old, and she said, I'm very mad at you, Dr. Lester. I said, well, what's the problem? She had colon cancer and she had the surgery. She says, I have so much energy, I don't know what to do with it. I have a walker, my body won't cooperate. I've got a ton of energy. The next visit, she came in, she was like, I'm going to use a word that I haven't used my entire life. I said, well, what is that? She said, I feel content.
Oh.
She's a
Oh.
feisty
Yeah.
woman. Her boyfriend's 98 and she's 94 now. They're a cute couple. And she was just going to let herself die. We got her saved, got the colon cut out, got her a colostomy bag, and then we started homeopathic care simultaneously. It's always combination. That's why we call it integrative medicine.
Can
The
I ask you a
layers are
question
of
about the stem
those-
cell again?
Oh, go ahead.
I just want to know, the stem cells come from a body of a person, or they are just extracted from somewhere else?
You can get it from your own body, from your bone marrow. You have to go to an orthopedic surgeon and they will crack through the hip joint, pull it out and create stem cells. Some people get it from adipose tissue, although the FDA is looking on that one, the first to shut down. They're not sure that one's effective. Or you can do it from amniotic extract, which is post-birth material from a 20-something-year-old woman after a normal birth. It doesn't come from the fetus. It comes from the umbilical cord, and that's where they get it. I use a company called Predictive Biotech. If you go on predictivebiotech.com, you'll see a very good company based in Salt Lake City, Utah, and that's where we get our stem cell material from. And it's alive. You're taking it from a 24-year-old, vibrantly healthy woman who wanted her baby, and after the baby's born normal, it's a joyous occasion, and that's the material you want. You want alive, vibrant stem cells. You don't want stem cells that are from negative experiences.
I'm curious, does this work then if I've had MS for almost 24 years? Will it still work if I've had it for that long?
It's not the number of years you had your problem, it's how many armor layers you've set up and how much aggressive deterioration to the myelin sheath it's done. So that's a hard call. It's not number of years, it's how many layers of armoring you've set up to drive the disease force deeper inside. Someone could only have it for 5 years and be very severe, like when we treat ALS. I treat ALS patients where it's extremely aggressive and difficult to treat. And then I had one ALS patient that we kept her alive for 20 plus years, and she lived to 84 years old, the oldest case they've ever seen at Stanford with ALS. And she was my patient, and we started when she was in her 50s and got her going. And so you never know. You got to get those armoring layers off, and it's how much aggressive antibody immune deterioration. It's how much you are hurting yourself. That's more the question. It's not the age. So there's always hope, but if you have an aggressive condition, I did have one woman, and they brought her to me strapped in a stretcher with a non-emergency ambulance. She was in my office. She was strapped down the stretcher because she has so much spasm and her legs were in contraction. She hadn't walked in a year, and she did get a little impatient, but we got her so she was able to move her legs again. She was able to get up on her knees. She was able to feed herself and use the commode, and those were great strides. Unfortunately, she kept saying, when am I going to run again? I want to start jogging again. And I said, well, let's just take step by step by step. And she would have very intense spasms. We had to treat those as well. It was a very challenging case. So she had it for 25 years also. We got to get to people as early as we can. Otherwise, the improvements are incremental. I have not done that many patients homeopathic combined with stem cell, because we've only been allowed to use stem cell in California for 2.5 years. So it's fairly new.
Yes, I have very bad spasticity and I have a baclofen pump, but even with that, I still have to take baclofen orally.
Yeah, well, I'm a Western medical doctor too, and baclofen is great, but if you combine baclofen with homeopathic, then the tendency to reduce those spasms is much more likely.
Mhm.
Any other questions? Okay, well, good luck. I hope that it shed a little light on it for you. You know, I had been doing this a long time, and it's something that MS is a serious condition, and it's not easy to get it turned around. I don't mean that by any means. We don't know exactly what we're going to do with it, with stem cell use, because it's still fairly new, but that adding those two things together are a very powerful combination. And you do your hypnotherapy, your psychotherapy, get into your unconscious, get it to connect, add some homeopathic to that, and sky's the limit. What can happen?
Yeah. One of my teachers was a homeopathic doctor and hypnotherapy, and he said it just really helped to like bring that stuff to the surface. And then it was so much easier to work with the hypnosis because it was there and ready and ripe, and it was a great modality. So I'm really glad to have you here today.
Yes, great.
Yeah,
Well,
thank you very much for your time. It's really encouraging to hear how much knowledge is out there and how much yet I have to learn. So thank you for your time. Really appreciate it.
oh, you're welcome. You're welcome. Well, thank you for inviting me. And as we learn more research with stem cell and that kind of approach or biologic injections, and more people, I keep statistics on every single patient we do. We've done over 250 now. A lot of those are just simple joint things. Some are for cardiovascular disease, pulmonary diseases, and not so much MS. So it'll be stay tuned for that because I don't think anybody has all the answers for that yet. But at least you don't have to fly to Panama or Germany or go down to Mexico. You can do it here in the United States legally now.
Cool.
We'll
Thank
see
you.
You're welcome.
Thank you.
Thank you.
Thank you.
Thank you.
Bye. Thank you.